Joining us now to discuss more about this is Dr. Jason Wilson, Associate Medical Director at TGH Emergency Department. Thank you so much for joining us, Doctor. Now, as a medical professional, what are your thoughts on this announcement? Do you agree with this?
Well, we're in a position right now where our vaccination rates in this country are a bit stuck. And we have a variant, the Delta variant, that is spreading and transmitting very rapidly. And the problem with that variant is it looks like the vaccine does provide good protection against hospitalizations. It does provide protection against even getting the virus. But if we do get the virus, even asymptomatic vaccinated people may have higher levels of virus and spread it around a little easier than these prior variants. And that means that masking will help decrease transmission, especially in these positions where we're just not quite vaccinated where we need to be. We got to get those vaccination numbers up.
Now, do you think this is all happening because we as the United States got rid of the mask mandate too soon?
So we're in a position also, I think, where we know what different social mitigation strategies work and when to use them. So we have a vaccine. The vaccine was being rapidly uptaken for a while. There was more demand than there was supply. That got flat now. But also when there was more supply or demand, there was supply. The variant that was around, that B.1.1.7 variant, wasn't quite as transmissible. So things weren't quite as bad as they are right now. But now we've entered a situation where there's vaccines sort of sitting on shelves. No one's really going to get it, and we've got a much more transmissible virus. So it's not that we stop masking too early. It's just that now we may have to pull that lever again to utilize masking as a social mitigation strategy because the vaccines aren't where we need them to be.
Now, the CDC is saying that schools should mask up but stay open for in-person learning this fall. What are your thoughts on this, given that we don't have authorized vaccines for all the kids yet and that the cases are ticking up so much that the agency had to bring the mask policy, like you said, back in the first place?
Sure. And so we've had a successful school year essentially throughout most of this country with masking for the entire year. So we know kids can do it. We know it's possible. We know it prevents transmission. And so I think at a place we're in right now with high numbers, like a place like where I'm at in Tampa, Florida, very high spread numbers, we're kind of back in that position where these closed indoor classrooms, we know people are going to be returning from the virtual world or the hybrid world back into these, indoor classrooms. We're going to need to likely mask while we wait for the emergency use authorization for the 5 to 12-year-olds to come out, and then hopefully get those numbers up a little bit in the adolescent age groups as well.
Now, how long do you think the new mask mandate will be in place? And again, tell me how effective it would be.
Sure. So we know masking works. We've got good data to understand that. We've got over a year of data to understand that masking works. Now, it is true that the more transmissible the virus variant is, the less effective our masks are, right? The masks are an extra shield, an extra piece of protection, but they're not bulletproof. So we always worry that a new variant arises, it's more transmissible even with the masks on. We're going to need to wear masks when the numbers are high. High means, something in that range of double digits per 100,000 cases. We want those numbers to be low, like 2 per 100,000. Then we can stop doing some of those social mitigation strategies that contain each case as it arises. But to get there, places that have vaccination rates around 50% probably need to move those up to closer to 75% to have a chance at stopping some of those other mitigation strategies like masking. We're going to be stuck with masking until we see those numbers go up.
Now, Pfizer released just this morning that the company is expected to submit an emergency authorization for vaccine boosters as early as August. Is the booster shot necessary? What are your thoughts on that?
So the booster shot will likely not be necessary for everyone. The booster shot will likely be for people who have some type of immunocompromise. Immunocompromise means that their immune system doesn't quite work as strongly as a healthy person's immune system. What we know so far is that the vaccines themselves have boosted the antibody response in people who have healthy immune systems, and some of that memory immunity is there as well. That's why even people who had the virus should still get the vaccine, because we know that that response they're going to have is so much stronger. But people who have weakened immune systems may need to see this booster sooner. Now, in the future, we may see other types of boosters arise or other types of vaccine add-ons sort of arise as we start to learn more about variants. Just like with influenza, we go get vaccinated every year. Maybe in the future, we'll see something similar to with the COVID vaccine. This first sort of round of Pfizer vaccine booster, though, will likely be concentrated in more immunocompromised patients.
Dr. Jason Wilson, Associate Medical Director at TGH Emergency Department. I appreciate you coming on the show this morning. Thank you so much again.